Hi guys, it's Hillary. This month we are talking about microneedling. So what does microneedling do? How does it work? All these great questions that I'm asked all the time. First of all, it's a cartridge that has 12 little tiny needles. And what those little needles do is cause micro injuries down into the dermis, because that's where we get restructuring to occur. When we cause these micro injuries, our body then says, wait, there's damage down there, we need to repair. And we start signaling all of these things that don't normally happen to us as we age to start to happen. You get collagen coming up to the surface and it starts to tighten the skin, and it does all these great things that we should be doing, but we're not doing anymore as we age. So I love microneedling. It's one thing that does not cause a lot of downtime. A lot of times patients are kind of red that day, the next day they look fine. This is the microneedling pen that we use, and we put a cartridge in there. As we're doing it, I always cleanse the skin first, or cleanse the area that I'm treating first, and then of course sanitize it with alcohol. And then I will use a slip depending on exactly the area that I'm treating. Those slips can be different. I will put my cartridge into the microneedling device and I set the speed and the depth, because I do want to get a little bit of pinpoint bleeding. I don't want it to be crazy bleeding or anything like that, just a little bit of pinpoint bleeding. And that way then whatever my carrier is, whatever that slip is penetrating down and doing more. So it's all working hand in hand, so that way we can start to restructure that area and make great changes. We are talking about microneedling with exosomes. So with microneedling, we're causing these little micro injuries into the skin, and we can choose what we want to kind of push into these little micro channels that we're causing to happen. And in this case, our slip and what we're trying to kind of get into that area is now exosomes. And what exosomes are, they send billions of little messages down to our cell level to tell our cells to do something it's not doing. So in this case, with exosomes, typically we're trying to stimulate collagen, tighten the skin. Maybe we're working on scarring, maybe working on loss of elasticity, stretch marks. We can use it for all kinds of different things. It makes the microneedling treatment, which in itself does a lot of good, but it makes it do even more. So you get more tightening. It's usually less treatments with microneedling that we need to do in order to see those great results. So if we're doing microneedling with exosomes on like a stretch mark area, I usually recommend about 3 to 4 treatments with it. We'll add the exosomes in every time, and you get more change and more tightening to that area because those exosomes are going down, telling those cells, hey, you need to start doing more collagen production and you need to start tightening this area, and it happens pretty quickly. I love exosomes. It does take a little bit of time to see a full result from exosomes in the microneedling, because all that restructuring is happening underneath the surface and our body is doing a lot of the work for us. So sometimes it can take a couple months to get your full result, but it's definitely worth it. I am going to talk about how microneedling with exosomes was used to treat my one patient for her stretch marks and her loss of elasticity in her stomach area. So with this patient, I brought her in and we decided that we were going to do a series of 4 microneedling treatments. And actually, after 2 microneedling, adding those exosomes in, we saw such great results. We did do the 3rd just to see how much more we can get. And then we're going to decide on that 4th one if we're going to do that soon or if we're going to kind of wait and do that more as like a maintenance a little bit down the road. But you can see with her how much tightening she got. She did lose some weight as she was going through this, which actually that often adds to more loss of elasticity as you lose weight, but you can see how it enhanced that skin tightening as she was losing weight. So not only are her stretch marks looking better, but her actual loss of elasticity has totally gotten tighter, and she's shown so much more improvement between that combination. I am going to talk about a patient of mine that we did hair restoration on. So with our hair restoration, we use a combination of our exosomes along with a hair growth serum. What they do is they will send these messages down and tell your cells to start stimulating that hair growth. So if it is a follicle that can start to generate again, it will help it to do that. We usually recommend 4 of the microneedling with the exosomes and or hair growth serum that's used the whole time that we do it. We cause these little micro injuries down into the scalp, which then tells, like I said, gives those messages for that hair growth to start. And we usually notice throughout the 4 treatments, it's right around like the 3rd treatment that you start to see these baby hairs coming up, and the 4th treatment, it just enhances that. And then over time, as your hair gets longer, you see more of a growth in there. Makes a big difference. And you can see with this patient how much more growth he actually got through his series of treatments. I love microneedling. There are so many different ways that we can use it. We can use it for stretch marks. We can use it for the acne scarring. We can use it for fine lines and wrinkles. We can use it for acne. We can use it for hair loss. So, please come and check out our website and schedule a consultation with Lébo, and we will be happy to help you.